Welcome to another deep dive. Today we're going to be talking all about dental restorations.
Okay.
And we're going to be looking at all sorts of stuff like the different types of restorations that are out there when you might need one, and just generally what you can expect if you're thinking about getting a dental restoration. And we've got some really great insights to share from an article on Pasted Text featuring a dentist, Dr. Khushbu Agarwal.
Sounds good. Yeah, it's interesting. When you think about it, we tend to think of going to the dentist as a reactive thing. We only go when there's a problem.
Right.
But, dental restorations can actually be preventative, too, in a lot of cases. And, of course, there's the aesthetic side of things as well, which is important to a lot of people.
Yeah, absolutely. So maybe let's just start with the basics. What exactly is a dental restoration?
Well, in the simplest terms, I guess you could say it's any treatment that repairs or replaces a damaged or missing tooth, or even just a part of a tooth.
Okay, that makes sense. But how do you know when you might need one? What are the signs?
Well, some of them are pretty obvious, like if you have a cavity or if you chip a tooth biting down on something hard.
Right.
But then there are also signs that are less obvious, like if you grind your teeth a lot,
Okay.
or maybe you have a small fracture that could get worse over time, or even if you just want to improve the appearance of your smile for cosmetic reasons.
So it's not always about, like, pain or a glaring issue, right?
Right.
I'm kind of curious, have you ever experienced any of those, like those signs? It's probably more common than we think, to need a dental restoration at some point.
Oh, yeah, for sure. I mean, I think most people have had at least one filling in their lifetime, right?
Right.
And that's why it's so important to understand the benefits of restorations. They're not just about fixing problems. They can actually, restore the function of your teeth and enhance you overall well-being, how you feel about yourself and stuff.
Okay, so let's talk about those benefits for a second. How can restorations impact both, how our teeth work, the functionality, and also how they look, the aesthetic part?
Well, think about being able to bite into, a crisp apple without any pain.
Yeah.
Or, feeling confident when you smile. Those are just a couple of examples of how restorations can really make a difference in your everyday life.
That's true. But, restorations aren't some kind of magical fix, are they?
Right.
I mean, there must be some risks involved too, right?
Oh, yeah, of course. There are always risks to consider. It's just like any medical procedure. You have to weigh the pros and cons. Restorations aren't permanent, for one thing. They can eventually break down, just like your natural teeth.
Right.
And for procedures like implants, which involve surgery,
Right.
there are inherent risks, like potential for infections or bleeding.
Yeah, of course.
So it's not something to take lightly.
No, definitely not. It sounds like it's really crucial to have an open and honest conversation with your dentist to really weigh the potential risks and benefits before making a decision.
Absolutely, yeah. Communication is key. And another thing to consider is recovery time.
Okay.
It can vary a lot depending on what type of restoration you're getting.
Oh, that's right. I imagine a simple filling might just be a quick in and out procedure, but something more involved like an implant could mean weeks or even months of recovery.
Yeah, exactly. So you definitely want to consider how that recovery period might impact your daily life, work, family, social stuff, and plan accordingly.
That's a good point. Okay, so now let's dive into the different types of restorations.
Sure.
It's like exploring a dentist's toolkit, right? Each tool is designed for a specific purpose.
Right.
And we've got a whole bunch to talk about: fillings, crowns, veneers, bridges, and implants, each with their own unique characteristics and uses. Where should we start?
Well, why don't we begin with fillings?
Okay, fillings.
They're one of the most common types of restorations.
Yeah, I feel like everyone's had at least one filling in their life, They seem pretty straightforward.
They are, relatively speaking. Generally, fillings are used to repair cavities, those holes in your teeth, or sometimes the holes that are left after you have a root canal.
Right.
They can also be used to repair worn-down teeth or to fill small gap between teeth. And what's interesting is that they come in a variety of materials.
Like what? What kind of materials are we talking about?
Well, there's the classic amalgam filling, which is the one that has that silver look.
Yeah.
But then you also have composite resin and glass ionomer fillings.
Okay.
And those can actually be matched to the color of your natural teeth.
Oh, wow. So they're pretty versatile then.
They are.
But I remember reading in Dr. Agarwal's piece that fillings aren't always the best solution, especially for larger areas of damage.
That's right. Yeah, fillings have their limitations. One thing is that they can stain over time, especially the ones made from composite resin.
Oh, really?
Yeah, because the material is porous, it can absorb pigments from the things you eat and drink.
Ah, so that's why some fillings might darken over time.
Exactly. And when it comes to larger areas of damage, a filling might not provide enough structural support. It's kind of like trying to patch a large hole in a wall with like a tiny piece of tape. It's just not going to hold.
Yeah, yeah,
So in those cases, something more substantial like a crown might be a better option.
that makes sense. You got to choose the right tooling for the job. Speaking of crowns, those sounds like a bigger commitment than fillings.
They can be.
What makes them more complex?
Well, crowns are custom-made caps that fit over your entire tooth, offering a lot more protection and support.
Oh, I see.
Think of it like a protective helmet for a weakened tooth, shielding it from further damage.
I like that analogy. So when would a crown be recommended instead of a filling?
Well, crowns are often used when a tooth is significantly damaged or weakened,
Okay.
like, for example, maybe from decay, a large filling, or a root canal. They can also be used to improve the appearance of a tooth if it's misshapen or discolored.
Yeah, I've heard that getting a crown involves shaping the tooth, which honestly sounds kind of intense.
It does involve some reshaping, yeah.
Okay,
The dentist needs to remove a portion of your natural tooth structure to create space for the crown to fit properly.
right.
But don't worry, the area is numbed, so you shouldn't feel any pain. You might feel some pressure, though.
Okay, that's reassuring. And what about the materials used for crowns? Are there different options there as well?
Oh, absolutely. Crowns can be made from a variety of materials: ceramic, porcelain, fused to metal, even gold.
Wow, gold. Really?
Yeah, gold crowns are actually incredibly durable, but they're typically used for back teeth where visibility isn't as important.
That makes sense. I imagine the choice of material depends on things like the location of the tooth and whether aesthetics are a priority.
Exactly. For visible teeth, porcelain or ceramic crowns are often preferred because they can be matched to the color of your natural teeth, so it looks more natural.
Right, so it's all about finding that balance between function and aesthetics, and I imagine that probably affects the cost too.
You're right, crowns are generally more expensive than fillings, and the cost can vary depending on the material used and the complexity of the procedure.
Okay, so there's a lot to consider when it comes to crowns, but let's move on to veneers. Those are like all about that Hollywood smile, right?
Veneers are definitely known for their cosmetic benefits. Yeah, they're thin, custom-made shells that are bonded to the front surface of your teeth, almost like press-on nails, but for your teeth.
Okay, so they're a good option for people who are like self-conscious about discoloration, chips, or gaps in their teeth.
Exactly. Veneers can create a dramatically more uniform and aesthetically pleasing smile.
Right, right. Dr. Agarwal mentioned that veneers require like minimal removal of your natural tooth structure, which seems like a good thing.
Yeah,
But she also mentioned that they're pretty fragile.
that's true. While veneers are very durable in terms of resisting stains and discoloration, they can be prone to chipping or cracking, especially if you bite down on hard foods or if you clench your jaw.
And since they're bonded directly to the front of your tooth, I imagine any damage would be pretty noticeable.
It would be. And it's important to remember that the process of placing veneers is irreversible. So once the enamel is removed to make space for the veneer, it's not coming back.
Oh, wow. Okay, that's definitely something to consider carefully. So veneers offer a great cosmetic solution, but they do require like some lifestyle adjustments and a real commitment to protecting them. What about bridges?
Okay.
I imagine those are literally bridging the gap where a tooth is missing.
Yeah, you got it. Bridges are fixed prosthetic devices that replace a missing tooth or multiple teeth, and they're anchored to the natural teeth on either side of the gap, just like a bridge spanning a river.
Oh, so those adjacent teeth kind of become like the pillars that support the bridge?
Exactly.
That's pretty clever. What are bridges typically made of?
They can be made from a variety of materials, similar to crowns. You've got gold, stained steel, ceramic, and even porcelain fused to metal.
Wow, so many options.
The choice often depends on where the missing tooth is, how much durability is needed, and also aesthetic considerations.
Okay, that makes sense. I'm guessing the process of getting a bridge is pretty involved, though.
It can be. Multiple appointments are usually needed. First, the dentist has to prepare the adjacent teeth, kind of like how they prepare a tooth for a crown, to make room for the bridge to fit securely.
Right.
And then impressions are taken to create a custom-fit bridge.
So you're not walking around with a gap in your teeth while you wait for the bridge to be made.
Not usually. The dentist will often put in a temporary bridge to fill the space while the permanent one is being made. And then once it's ready, you go back to have it permanently cemented into place.
It's incredible how dentistry can rebuild a smile, piece by piece. And finally, we come to implants, which seem like the most advanced option in the dental toolkit.
They are certainly the most integrated solution, yeah. Implants involve surgically placing a titanium post into your jawbone, which acts as an artificial root for a replacement tooth or a bridge.
Titanium root, that sounds almost futuristic.
It kind of is, and one of the biggest advantages is that implants are incredibly durable and offer a very natural look and feel.
Okay.
They can last for decades with proper care.
Wow.
However, it's important to note that it is a more invasive procedure than the other options because of the surgery involved.
Right.
And Dr. Agarwal emphasized in her article that good oral hygiene is absolutely essential for implants to be successful.
So that means if an implant fails to integrate properly with the jawbone, that could lead to complications.
Exactly. And implants are just as susceptible to gum disease as natural teeth.
It makes sense. So it's not just about the initial procedure, it's also about that long-term commitment to taking good care of it and maintaining it.
Yeah, exactly. Implants are a fantastic option for a lot of people, but they're not a one-size-fits-all solution. A careful discussion with your dentist is really important to determine if they're right for you.
This deep dive into different types of dental restorations has been so informative. It's amazing how far dental technology has come, offering so many options for restoring both the function and the aesthetics of our smiles. But getting a restoration is only half the battle, right?
Right.
Caring for them properly is essential to making that investment last.
Absolutely.
So what can our listeners do to keep their restorations in tip-top shape?
Well, it really comes down to good oral hygiene.
Okay,
It's essential for everyone, but it becomes even more important when you have restorations.
that makes sense. So we're talking about the basics like brushing and flossing?
Right, but there are also some specific tips for people with restorations.
Okay, like what?
Well, for example, bridges.
Okay,
They actually require a special type of floss to clean underneath the prosthetic tooth properly. Yeah, it's called a super floss, or sometimes a floss threader, and it helps you get into those hard-to-reach areas.
that's fascinating. I never knew there was a special floss for bridges. You learn something new every day.
Right.
So good oral hygiene is crucial, but are there any habits people with restorations should avoid?
Oh, definitely. One thing Dr. Agarwal strongly advises against is using your teeth as tools.
As tools?
Yeah, like to open things.
Oh, like a bottle opener.
Exactly. It might seem convenient in the moment, but it can put a lot of stress on your restorations and even damage them.
Oh, I'm definitely guilty of that sometimes. Using my teeth to open a stubborn bag of chips or a package. But I'll definitely think twice about doing that now. It's just not worth the risk of damaging a restoration.
Exactly. It's a good reminder that our teeth, whether natural or restored, are precious,
Yeah.
and we need to treat them with care.
Okay, so now let's switch gears for a moment and talk about the potential risks associated with dental restorations. We touched on it briefly earlier, but it's worth, delving a little deeper.
Sure.
While dental restorations are generally very safe and effective, it's important to be aware of those potential risks and complications, just like with any medical procedure, right?
Right.
So let's start with fillings. Since they're the most common type of restoration, are there any risks associated with those?
Well, fillings are generally considered very safe, but there's always a small risk of complications. For example, some people might experience an allergic reaction to the filling material,
Okay.
or sensitivity to hot or cold temperatures, or in rare cases, even an infection.
So those sound relatively minor, though. Is there any long-term risks associated with fillings?
Well, one thing to keep in mind is that fillings aren't permanent. Over time, they can wear down, chip, or even crack.
Right.
And this is especially true for amalgam fillings. Those tend to be more susceptible to these issues compared to composite fillings.
I see. So regular dental checkups are important to, monitor the condition of your fillings and catch any problems early on.
Exactly. Early detection and intervention can really prevent further damage to the tooth.
Okay, that makes sense. What about crowns? What are some of the potential risks associated with those?
Well, with crowns, one of the main risks is that the crown itself could become loose or dislodged over time.
Oh, okay.
This can happen if the cement that's holding the crown in place weakens, or if the tooth underneath the crown becomes decayed.
So it's not just about the crown itself, but also the health of that underlying tooth.
Exactly. That's why good oral hygiene and regular dental visits are so crucial for maintaining the longevity of crowns.
And what about veneers? Are there any, unique risks associated with those?
Well, as we mentioned before, veneers are quite thin and delicate, so they can be prone to chipping or cracking, especially if you bite down on hard foods or clench your jaw.
Right, and since they're bonded to the front of the tooth, any damage to the veneer would be quite noticeable.
Yeah, it would be. And as we discussed earlier, the process of placing veneers involves removing a thin layer of enamel, and that's irreversible, so it's a decision that should be made carefully, weighing both the benefits and the potential risks.
Absolutely. Okay, let's move on to bridges. What are some of the risks to consider with those?
Well, similar to crowns, bridges really rely on the health of the adjacent teeth for support.
Okay.
So if those teeth become decayed or damaged, it can affect the stability of the bridge.
So it's like a chain reaction.
Yeah, kinda.
The health of one tooth can impact the entire restoration.
Right. And because bridges span a gap where a tooth is missing, there's also a risk of food particles getting trapped underneath the bridge,
Oh, right.
which can lead to decay or gum disease if it's not cleaned properly.
That's a good reminder to be diligent about flossing, especially if you have a bridge. And using that special floss designed for bridges sounds even more important now.
Oh, absolutely. And lastly, let's talk about implants, which tend to have, more potential risks because they involve a surgical procedure.
Right. What are some of the things that could go wrong with implants?
Well, during the implant surgery itself, there's a small risk of nerve damage, infection, or sinus problems, depending on the location of the implant.
Those sound like pretty serious complications.
They can be, but it's important to remember that they're relatively rare. Experienced dentists and oral surgeons take every precaution to minimize those risks.
Okay, and what about risks after the surgery?
Well, after the surgery, there's a risk that the implant might not integrate properly with the jawbone.
Okay.
It's a condition called implant failure. This can happen due to factors like poor bone quality, smoking, or infection.
So maintaining good oral hygiene and following your dentist's instructions are absolutely crucial for the success of implants.
Absolutely. And regular checkups are essential to monitor the implant and make sure it's staying healthy and stable.
Okay, so this discussion about risks has been really informative, but I don't want our listeners to be, scared off from getting dental restorations.
No, not at all. It's all about being informed and weighing those potential risks against the benefits.
Right, exactly. Dental restorations can dramatically improve your oral health, the functionality of your teeth, and, your smile aesthetics.
Right.
It's just important to go into the process with a clear understanding of what's involved.
I couldn't agree more.
And remember, every individual is different. What might be the best option for one person might not be suitable for another.
That's why it's so important to have a thorough consultation with your dentist, discuss your concerns openly,
Yeah.
and work together to develop a personalized treatment plan that aligns with your specific needs and goals.
Okay, so now let's shift gears and talk about another important aspect of dental restorations, and that's the cost.
Okay.
We know that dental care could be a significant expense, and restorations are no exception. So let's break down some of those cost factors and help our listeners understand what we expect.
Sure. The cost of dental restorations can vary quite a bit. It really depends on several factors, including the type of restoration, the materials used, the complexity of the procedure, the dentist's experience and location, and of course, your dental insurance coverage.
So there's no one-size-fits-all answer when it comes to cost. Okay, let's start with fillings. Since they're generally the most affordable type of restoration, what's the typical price range for fillings?
Fillings can range from around $50 to $300 per tooth. Again, it depends on the size of the filling, the location, and the material used.
Okay.
For example, composite fillings, which are the tooth-colored ones,
All right.
those tend to be more expensive than amalgam fillings.
Okay, that makes sense. And what about crowns? Those seem like they'd be significantly more expensive than fillings.
They are. Crowns can range anywhere from $500 to $2,000 per tooth. Factors that influence the cost include the material used. Porcelain crowns, for example, are more expensive than metal crowns, the dentist's fees, and your geographic location.
And what about veneers? Those are often considered a cosmetic procedure, so I imagine they can be quite pricey.
You're right. Veneers can range from $500 to $2,500 per tooth, depending on the material used, how many veneers are needed, and the dentist's expertise. Porcelain veneers tend to be more expensive than composite veneers, but they also offer greater durability and stain resistance.
Okay, let's move on to bridges. What's the typical cost range for those?
Bridges can cost anywhere from $1,000 to $5,000, depending on the number of teeth being replaced, the materials used, and the complexity of the procedure. Obviously, a bridge that replaces multiple teeth will be more expensive than one that only replaces a single tooth.
And finally, we come to implants, which, seem like they would be the most expensive option of all.
They are. Implants can range from $1,500 to $6,000 per tooth. This price typically includes the cost of the implant itself, the abutment, which is the connector piece, and the crown.
Wow, that's a significant investment.
It is, but it's important to remember that implants are designed to be a long-term solution. They can last for decades with proper care.
So while the upfront cost might be higher, it could actually save you money in the long run compared to other options that might need to be replaced more frequently.
Exactly. And when considering the cost, it's important to factor in the potential cost savings of avoiding future dental problems that could arise from not replacing a missing tooth.
Okay, this discussion about costs has been really helpful, but I know that dental expenses can be a real barrier for a lot of people. What advice do you have for our listeners who might be struggling to afford dental care?
Well, it's a valid concern. Dental care can be expensive, but there are options available to help make it more affordable.
Like what?
Well, first, always check with your dental insurance provider to see what procedures and materials are covered under your plan. Many plans cover at least a portion of the cost of preventative care, fillings, and even more extensive restorations like crowns and bridges.
So it's always worth exploring your insurance benefits before assuming you can't afford treatment.
Absolutely. And if you don't have dental insurance or if your plan has limited coverage, there are other options to consider.
Okay,
Many dentists offer payment plans or financial options to make treatments more manageable. You can also look into dental discount plans, which offer reduced fees for dental services in exchange for an annual membership fee.
those sound like really helpful options. Are there any other resources available for people who might be struggling?
Yeah, definitely. Many communities have free or low-cost dental clinics that provide services to those in need. You can also check with your local health department or social service agencies to see what resources are available in your area.
That's encouraging to know that there are resources available for people who might not have traditional dental insurance or the financial means to pay for these procedures out of pocket.
Absolutely. Dental care is such a crucial part of overall health and well-being, and no one should have to go without it due to financial limitations.
Well said. This deep dive into the cost of dental restorations has been really enlightening. It's given us a realistic view of the potential expenses involved
Yeah.
and highlighted some valuable resources for making dental care more affordable.
I agree. And remember, listeners, don't let cost be a barrier to getting the dental care you need. Talk to your dentist, explore your options, and together, you can find a solution that works for both your budget and your oral health goals.
This has been a really comprehensive deep dive into the world of dental restorations. We've covered a wide range of topics from the different types of restorations and the procedures involved to the potential risks and complications, the cost factors, and the importance of aftercare.
Yeah, it's been great.
And we've really emphasized the importance of having that open and honest communication with your dentist, right?
Absolutely.
It's about staying informed about your options and taking an active role in maintaining your oral health.
Couldn't agree more.
But before we wrap up, I want to leave our listeners with a few key takeaways to keep in mind as they navigate their own dental journeys. So as we conclude our deep dive into dental restorations, what are some of the things our listeners should remember?
Well, I think the biggest takeaway is prevention is key. Practicing good oral hygiene, eating a healthy diet, and seeing your dentist regularly can really go a long way in reducing your risk of needing restorations in the first place.
Right, like it's nuts easier and probably cheaper too to prevent those problems than to deal with them once they, become serious.
Exactly. And if you do find yourself needing a restoration, don't be afraid to ask questions. Advocate for yourself. Make sure you understand what's involved.
It's about being an active participant in your own oral health, right?
Absolutely. Your dentist is there to help guide you, but ultimately, you're the one who has to live with the decisions.
It's a partnership. They bring the expertise and you bring your needs and preferences.
Right. And it's important to remember that dental technology is constantly evolving, so what might have been the only option a few years ago,
Yeah.
there might be something even better available now.
It's exciting to think about all the new materials and techniques that are constantly being developed. It's definitely worth, staying curious and talking to your dentist about those advancements.
I agree. And finally, I just say, don't underestimate the power of your smile.
Yeah.
It's a reflection of your overall health and well-being. It can really impact your confidence, your quality of life.
A healthy smile can light up a room, make a great first impression.
Absolutely.
Investing in your oral health is an investment in you.
Well said.
This deep dive has been an incredible journey into the world of dental restorations. We've learned so much, but I'm sure our listeners probably still have questions.
Probably.
As always, we encourage you to continue exploring, consult with your dentist, and stay informed about the latest in dental care.
And remember, your smile is a precious gift. Take care of it, and it will reward you for years to come.
Until next time, keep smiling and keep learning.